Hi, dear listeners and viewers. Welcome to the presentation on the subject of stress, anxiety, and depression. Let us first of all start with the definition of these terms stress, anxiety, and depression. In English, they are interchangeably used, but technically they have different meanings. Stress. Stress is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. It's a feeling of extreme worry, sadness, or pain. It's a situation in which you are suffering or are in great danger and therefore in urgent need of help. Anxiety. It's an uncomfortable feeling of nervousness or worry, fear or worry about something that is happening or might happen in the future. Eagerness to do something may also be called anxiety. Depression. Depression is a feeling of severe despondency and dejection. It is a state of low mood and aversion to activity. It can affect a person's thoughts, behavior, motivation, feelings, and sense of well being. What are the causes of stress and anxiety? There are a number of causes, but few are listed over here. Number one, interpersonal relationship. This is usually the main reason for stresses. And most another most common reason is financial difficulties. Third is environmental adjustments, academic difficulties, time management, traumatic event, substance abuse, eating disorders. We have seen in the past slides common causes of stress and anxiety. Now let us see common causes of depression. There are many factors. Some of them are or most important factors are life events. Some tragic events may have happened, and those have gone into your subconscious, and they may be causing depression in the personality. Person's personality may be such that he focuses more on tragic events and less on happy events. This may also be a factor in causing depression. Medical treatment. There are medicines, some medicines which cause depression in the person taking those medicines. Substance induced. Substance here means drugs. Drugs induced depression are known, and people know very well that such drug abuse can cause depression. Non-psychiatric illness. There are some illness which, like cancer or terminal illnesses, which may cause a person to go into depression, thinking that there is no life left, no hope, no cause of happiness or anything. He is destined to die very soon. For that reason, he may go into depression. Psychiatric syndromes. Psychiatric syndromes are a person may go into a syndrome of depression for a long duration or short duration. These are psychological effects. Historical legacy. There may be historical legacy. Some ancestors may be having such depression, or maybe patients of depression, which may have passed on to the person. Signs of stress and anxiety. You may have noticed that I am dealing stress and anxiety separately and depression separately, because depression is a very special subject and needs special concentration. To see the signs of stress and anxiety, first of all, let us see the physical concerns, physical things which are apparent, obviously, and those are deterioration in physical appearance, including deterioration in grooming and hygiene. He no more takes interest in grooming himself or his hygiene or cleanliness. Sudden weight loss. He starts taking less interest in his diet, Because of his stress and anxiety, his digestion system is also disturbed. For that reason, he loses weight. Excessive fatigue, sleep disturbances, poor concentration. A person starts feeling fatigue very quickly, cannot sleep properly and deeply, um, and cannot concentrate on any particular subject or any matter for a long time. Alcohol and other drug abuse. He starts drinking alcohol just to have a temporary relief from the stress. Self-injurious behavior. He starts hurting himself or taking some poisonous things, just to as a suicidal attempt. He wants to injure himself, to punish himself for something, some act which he is imagining that he has done. For that reason, that something has happened, and that's why he is in the stress and anxiety. Irritability. He gets angry or anxious very quickly. Nervousness is very uh, quickly induced. Muscle tension. His muscles are tense, and restlessness. He is restless or anxious, nervous. We are continuing with the signs of stress and anxiety. We have seen the physical concerns signs. Now we are having a look at the signs of psychological concern. There can be direct or indirect statement by such persons of their intention to harm themselves or others. This is one sign, and the other is direct or indirect statement that suggests hopelessness and worthlessness and suicidal or homicidal idealization. The person may be suggesting that there is no hope, there is no purpose of living, and such statements should be taken seriously if a person is stating like this. Self disclosure of personal distress that could include family problems, financial difficulties, grief, domestic violence, being starved, sexual assault, have crimes, eating disorders, substance abuse, panic attacks, etc., etc. And tearfulness. Person is very easily exhibiting tearfulness. Tears come easily in his eyes. Excessive worry, anxiety, fear, or panic is also a sign, a psychological sign. Change in relationship, for example, withdrawn, more animated than usual, excessive dependence on others. We are in the third category of signs, and for stress and anxiety, and these are safety concern signs. Such a person unprovoked shows anger or hostility without any apparent provocation. He may make implied or direct threats to harm himself or to others. He may exhibit erratic or unusual behavior, peer expression of concern, a gut level reaction that something is wrong. Now we come to the subject of depression. The signs of depression can be summarized in an acronym called GEMS ICAPS. Let us see what are these. G for guilt. There is always a feeling of guilt about some imaginary wrongdoing by the person who is in depression. Energy, decreased energy. He shows slackness and fatigue. Mood, always in depressed mood. Sleep, increased or decreased sleep. This is also a sign of depression. Interest, he shows decreased interest in general activity. Concentration, his ability to concentrate is decreased, and even the desire to concentrate is also decreased. Appetite, Changes in appetite may increase or decrease. He may have he may be eating normally more or not at all, or very low quantity of diet he is taking. Psychomotor may exhibit agitation or retardation. Suicidal ideation, showing appreciation or inclination towards suicide. We have seen the causes and signs of anxiety and stress as well as of depression. Now let us see how to get relief from these from the stress and anxiety and depression. First of all, let us, as usual, as is the trend in this presentation, we will go for the stress and anxiety first, and then we will handle depression afterwards. Stress and anxiety are common experiences for most people. In fact, according to one study, 70% of adults in the United States say they feel stress or anxiety daily. First and foremost advice is to seek medical and professional help if the signs of distress and anxiety get serious and out of hand. There are some home remedies which can be relied upon as long as the subject feels himself in control and can follow the measures. These home remedies are given in the following slides. Some of the home remedies for relieving stress and anxiety are, first of all, exercise. Regular exercise can help lower stress and anxiety by releasing endorphins and improving your sleep and self-image. Supplements. You can take supplements, and they most commonly recommended are omega-3 fatty acids, green tea, and lemon balm. Aromatherapy. Aromatherapy can help lower anxiety and stress. Light a candle or use essential oils to benefit from calming scents. You can reduce your caffeine intake or spend time with friends and family. Having strong social ties may help you get through stressful times and lower your risk of anxiety. Indulge in humor. Discuss your concerns. Talking with a trusted friend helps relieve stress and may provide a more positive perspective on your situation. This may lead to healthy plan of action. Use stress management and relaxation techniques such as visualization techniques, meditation, yoga are examples of relaxation techniques that can ease anxiety. Learn to relax. Your goal is to lower your heart rate and blood pressure while also reducing muscle tension. Make sleep a priority. Do what you can to make sure you are getting enough sleep to feel rested. If you aren't sleeping well, see your doctor. A couple of more adjustments, more stress relieving suggestions. Dietary adjustments. The mineral magnesium helps muscle tissue to relax, and a magnesium deficiency can contribute to anxiety, depression, and insomnia. Inadequate intake of vitamin B and calcium can also exacerbate anxiety symptoms. Make sure your daily diet includes foods such as whole grain cereals, leafy green vegetables, and low fat dairy products. Last but not the least, that is structured problem solving. Some people with anxiety disorders are worriers who fret about a problem rather than actively solving it. Learn how to break down a problem into its various components and then decide on a course of action is a valuable skill that can help manage generalized anxiety and depression. Now we come to see how to relieve depression. Depression is a serious matter. For that reason, it is always recommended that medical and professional help should be sought for treatment of depression. However, following actions are also advised. aerobic exercises, mindfulness, the vocational rehabilitation, social skills training, positive thinking, and sadaqah. Giving sadaqah gives you a good feeling, and it can relieve to some extent your depression. Now, on a lighter note, we must remember two acronyms, that is fun and fast. Fun, let us take fun first. Here, F is for fresh food, fresh vegetables, and fresh air. U is for unprocessed or least processed food. N for non-addictive. Whatever you take, this should comply with this FUN categories. There is another acronym is FAST. FAST, the same things. Fresh food, fresh vegetables, fresh air. A for active, activity and activeness. Be active in all aspects of life. S, sleep well, at least 8 hours a day. T, temperate. Keep your temperature and your attitude in a temperate manner. Mild and happy person. For any questions and answers, please send your questions on the email mentioned below, or a message only, not call, but message on WhatsApp. Thank you. Thank you very much for your precious time and listening to this. Please do follow these instructions and stay happy, healthy, and safe.